Is the camera taking us in? Okay. Whatever.
I think it is Facebook on this computer.
Is that what you told him?
I mean,
Yeah. I just
I
can't
think
see
it should mainly focus on Dr. Katranji and myself
Okay.
primarily. Mainly me, but
Mostly
no.
him, though.
So, but we're on Facebook Live right now. Yeah.
Yep, Facebook is
I'm sorry?
live and YouTube is live.
Facebook and YouTube are live. So I was talking to Dr. Katranji about this new program that he's going to study.
About the
with-
zygoma thing?
Yes, right. And should he talk about it on, on the show live?
Absolutely.
Yeah, I think so. Well, so what do you want to start with? Coming back to the beginning.
Well, I want to start with a patient I saw today that
Perfect. Yes. That's fine.
I'd seen several years ago, 3 or 4 years ago,
Uh-huh.
and he did not proceed with treatment.
Oh,
I saw him today. I couldn't save his teeth. All of his teeth the bone had been destroyed in such a short time, 2 to 3 years, that what I could have saved 2 or 3 years ago, he now can't save any of those teeth. And I told him all those teeth have to come out.
and Dr. Katranji, can you put him new teeth? Can you?
I put him. I deliver the new teeth.
Oh, Amar, I have a quick question.
Yeah.
There is a genetic test for susceptibility to periodontics, isn't there? Periodontal disease.
There's like the IL-1 test.
I don't remember the name of it, but there's something.
Yeah. So there are tests that show like an increased level of certain breakdown markers. So if you happen to have that genetic expression, then you typically will have a higher chance of periodontal disease.
So there's hope for this patient or no?
No, I'm saying no. With in regards to holding on to their teeth, no.
But replacing them. Welcome to the special live radio show where you can call in with your questions and talk to the doctors directly. I'm your host, Anne-Marie Cronin, and we are here tonight talking with Dr. Joseph Nemeth and his partner, Dr. Amar Katranji, both board-certified periodontists in Southfield, Michigan. Both doctors are here with us discussing their state-of-the-art clinic and the latest treatments in periodontic care and the relationship between gum disease and many systemic diseases. If you have a question for the doctors on the matters we're discussing tonight, please call us at 800-859-0957. Dr. Nemeth, Dr. Katranji, welcome again to your very informative live radio show. Dr. Nemeth, what's new in your office that you want to tell the listeners?
Well, as I was just mentioning to you, I wanted to talk about a couple of patients that I saw today. The first patient that I'm going to talk about was in my office about 3 years ago and had periodontal disease, and it was fairly advanced, but definitely treatable with Lenap. I think we could have stopped the infection. I think we could have saved those teeth and improved his health as well, because gum disease is related to so many health problems. So he decided that he was ready for treatment, apparently. So he came back today. This is after about 3 years. I saw the x-rays, which they brought to me before I went in to see the patient, and I said, there's no bone left. There's no bone left. It's truly beyond help. I went in, I saw the patient, I talked to him, and I said, I would feel guilty taking your money to treat you, because you've lost all that bone that was there 3 or 4 years ago that would have enabled us to probably save most of these teeth. So unfortunately, there was really nothing that I felt I could do and that would really be helpful. And I told him that he's going to have those teeth removed. And I suggested he see Dr. Katranji for implants, because that's exactly what he needs. What's called all-on-4 implants in a day, that sort of thing. We take out all of the teeth that have to come out and put implants in, or Dr. Katranji does, and I don't know anybody better in the state or in this part of the country or in this part of the world or in this part of the universe who's any better at that than Dr. Katranji is. And you know, I referred him to Dr. Catrangi for a consultation. So I don't see this very often, but it progressed very, very rapidly, and it was beyond the point of salvaging. And one other patient that I saw that was very interesting. It was a young woman who had extensive orthodontics, and she was now having gum recession, and she was very concerned about the gum recession, which I definitely felt we could help with the pinhole technique. We could stop the gum recession. We could build up that gum tissue and get some thick, healthy gum tissue that would prevent further gum recession and cover those roots, because some of them were getting sensitive. But she said, you know, my mother lost her teeth at an early age, and I'm just wondering if I'm susceptible to that also. But her bone level was generally pretty good. She was 26 years old. She said, well, is there a genetic test for periodontal disease? And actually, there is a genetic test. It's not really precise. It's not terribly accurate, but it can be helpful. So if her mother lost her teeth, all of her teeth, at a very early age, which is what happened, she wanted to know maybe she should have this genetic test. But she was 26 years old. There was no significant bone loss from periodontal disease. Yes, there was gum loss and bone loss from gum recession, but not traditional periodontal disease. And so I said, you know, if you don't have signs of advanced bone loss at this point, I don't think you have to worry about the genetic problem. You do have to worry about the recession, and we will be able to treat that and correct that. So that just happened today, and it was a couple of interesting patients that were a little bit unique in that one was beyond help, unfortunately, which is extremely rare, other than having implants would be the answer. And the other one had a mother who had lost all of her teeth at an early age and was interested in her genetic situation.
Well, one thing, of course, you've got Dr. Catrangi here. So if somebody gets to the point where they've lost so much time in between the first consultation and when they decide to take action, which in this patient's case was 3 years, I mean, you know, it's a shame that that patient got to the point that there was nothing left but to extract all the teeth. But fortunate that in your office you have Dr. Catrangi. Dr. Catrangi, could you have replaced him with implants?
Yeah, so unfortunately, like you said, there are times where we just can't save teeth,
Right.
and it is rare, and especially with the technology. And if we get to people soon enough, a lot of times we can save them. But in this case, and some other cases, we need to take the teeth out. And in many ways, in many cases, we can place implants the same day, and put a bridge on, a temporary something that they can go home with, where they can smile, talk, and chew. So there are some solutions for these patients, where they can have almost an instant smile, an instant rehabilitation.
So all is not lost. There is hope.
All
They
is not
can-
lost. All is
Well,
not-
that's good to know, and all in the same office. I mean, you know, if you get a poor diagnosis that you're going to have to lose your teeth, at least Dr. Catrangi is able to do something and give implants, and so they're not going to walk out gumless. Let's come back and talk some more about this on the other side of the break. In the meantime, you're listening to the Dr. Nemeth and Dr. Catrangi radio show. Both doctors are here tonight talking about the seriousness of undetected gum disease and how the treatment of gum disease can prevent many catastrophic diseases. If you have a question, you can call us at 800-859-0957. Again, that number is 800-859-0957. Don't miss this opportunity to talk to the doctors directly. You're listening to the Dr. Nemeth and Dr. Catrangi radio show on 760 WJR. Wow. Back on Facebook, are we tuned in? We got it working.
Is everyone
Hi.
able to hear me or see me?
Hi, Siobhan.
Yeah.
We're able to see you.
Hi.
Hello?
Sorry, I'm late and tuning in, but I'm glad to be here.
You are. Where are you right now in the U.S.?
I'm in Joliet, Illinois, which is basically outside of Chicago.
Are you at the prison?
No,
No.
Julie. Doing a
Although
show.
although this is one of the smaller venues, so yeah, I didn't realize is there a famous prison here?
Yeah, I think Joliet. You've heard of Joliet. Yeah, Joliet is famous. I haven't been there personally, but
Oh,
I think it's a federal prison, isn't it?
I think so,
It's
yeah.
Interesting.
it's very famous. Yeah.
Okay, all right, I'll have to look it up.
And then you have a show this week in Grand Rapids.
What?
Yeah, we're doing a big festival in Grand Rapids on Friday, I believe.
Yeah.
So we're heading back to the region.
And you're expecting to have how many people come to the show?
I mean, that festival, I'm not sure. That'll be thousands.
Right.
I don't know the exact count of the festival attendees, but those are big shows. They're all
Right.
outside, big festival stages.
Yeah.
Beth?
Well, there we go. So we're glad to have you joining us from Joliet. And
What is this?
anyway, so Dr. Nemeth is busy
These
checking
are
on
YouTube
something.
questions.
questions. These are from Tina. This is from
Are you getting feed? I guess. Are you getting Facebook feed?
Mm-hmm.
Okay, good. And Siobhan is as well.
Yeah.
Yeah, we had a little bit of a problem here a little bit earlier, but I think we're all set now. One of the things that when we come back, we should talk about the fact of, I think, Olivia being here. And
I
how,
definitely want to talk.
because really about young people, because young people think they're home free, that nothing's ever going to happen or go wrong, and you don't lose your teeth until you're 80 years old, which is just not true.
Right.
So she's doing really well. Yeah.
Closer to the mic.
And we should definitely come back to that. Especially since she's here and looking good.
Absolutely. And we can answer some questions even though we're not on the air. We're still being recorded, and
Sure.
our viewers will still get some answers.
Absolutely.
And maybe save some of the really important stuff for when we're
Okay,
on the air, which is 30 seconds from now.
right. Okay, is it close enough now? Right in front, okay.
Or just sit up straight.
Welcome back to the Dr. Nemeth and Dr. Katranji live radio show. I'm your host, Anne-Marie Cronin, and we're here tonight talking to the doctors, both board-certified periodontists in Southfield, Michigan. They're here with us discussing the latest treatments in periodontic care and the relationship between gum disease and many systemic diseases, from cardiac disease to the prevention of Alzheimer's. If you have a question for the doctors, please call us at 800-859-0957. Doctors, I just want to mention here that we are fortunate to have one of your patients back, Olivia, who had the treatment done, thinking at 21 years old, there's nothing wrong with my teeth and I'm okay. Can you talk a little bit about how that everything you do applies to young people and not just older people?
Well, for people who were listening last time, Olivia came to my office. We did an examination, and her gums bled profusely and very easily. We took a sample and put it under the microscope. It was loaded with parasites, loaded with bacteria. She was highly, highly, highly infected. She didn't even realize it, but definitely needed treatment. And she happens to be here tonight. And we caught it early enough. Sue, my assistant, is here also, and she talks about the key is prevention, getting it early. Anyway, Olivia was fortunate enough. She's young. We caught it early. She's going to keep her teeth the rest of her life as long as she does her home care, and she is doing her home care. And Olivia, you're getting almost no bleeding now, correct? Yeah. You want to come here for a second? Come on. So you were in the office and almost no bleeding anymore, right?
Correct. No bleeding.
Yeah.
Not a single drop.
Right. I mean, you have a new mouth, basically. It's a healthy mouth, and now your body is healthy.
Correct.
Because with the infection that you had pouring into your bloodstream from your mouth, you could not possibly have a healthy body. Now that infection is gone, your body has a chance to fight off the infection that was pouring into your body, because it does have defenses, but it has to have a chance to use those defenses. And you're doing a great, great job. And your mouth is beautiful.
Thank
your mouth is
you.
beautiful. Tissue's not red. It's not bleeding. As long as you do your job, you're going to keep those teeth for the rest of your life. I
Thank
truly
you.
believe.
And I've noticed that our teeth are bigger looking, and so our smile is bigger looking, cosmetically. It wasn't a cosmetic job, obviously, but the
Right.
first thing I noticed after things started to be visible was that, wow, you're like movie star, these big teeth.
Sure.
And
See,
it's just cosmetically
yeah,
beautiful.
well, what happens is when you have infection, your gum tissue is swollen very often. And
Mhm.
when we eliminate the infection, the swelling goes down, and some of that swelling covers some of the teeth. So when the swelling goes down, the gum shrinks, it's healthy, more of the tooth shows, and very frequently, like in Olivia's case, her smile just just becomes brilliant and complements the rest of her beautiful face.
And I think the lesson to be learned here that we talk about a lot is the fact that young people just think they've got a pass, that they're okay, that they can't possibly have parasites in their mouth, they can't possibly have deteriorating, gum disease. They just don't think about it. And as you have said many, many times on the show, if your gums bleed, they're never supposed to bleed, never, never, never. And you just really don't know. But young people need to take notice. Siobhan, you have a caller?
Yeah, so we have Alicia on the line in Lansing. Alicia, what's your question?
Actually, I had some posts put in the bottom, and I had cadaver bone put on top. Nothing has held. All the posts have failed on the bottom, and the cadaver bone only 30% held. Do you have any advice going forward?
I think that's a question for Dr. Katranji. So you say you've had what you call posts or implants put in?
I did have implants put in, and then they put the cadaver bone on top, and both have failed.
I'll let Dr. Katranji, who is really has such great expertise on implants, I'll let him
Yeah, so
talk about this one.
so my question to you is this was this part of a denture? Did you have a denture before, or are you wearing a denture now?
I had a denture on top. They removed the teeth on bottom to put the post in because my bone's deteriorating and everything has failed.
Okay, so but again, are you wearing a denture on the bottom, or do you have teeth that are surrounding the area?
I have what they call a flapper on bottom. I still have my old denture on top.
Okay. So this is what I would say. First, obviously, it's very difficult without knowing the full, the scope of the treatment. But I will say that in many cases, these situations will require maybe a specialist or somebody who's, very involved with these types of cases. So when you have an implant failure or implant complication, it's very important for you to take away any type of temporary. You don't want anything touching the area. And then it's also important to assess the adjacent teeth. So all the teeth in there, are they healthy? Why did you lose the teeth? If you have gum disease, for instance, and that gum disease is sticking around the teeth next to the implants, a lot of times those implants don't heal properly because the bacteria hasn't been taken care of. So, there's a lot of questions that I have, and unfortunately, without actually seeing you and just kind of, doing a clinical exam, it's going to be tough for me to give you any definitive answer.
There are so many factors involved in the success or failure of an implant. But for instance, if you have osteoporosis and you were taking something for the osteoporosis, that can complicate the success. If you smoke, that can complicate the success. There are just numerous factors, but by and large, implants are very successful. And how do I know? Because I have 2 implants in my mouth, not from periodontal disease. No, no, no. I have 2 implants in my mouth because I had a root canal, a couple of root canals done, and they failed to the point where the tooth had to be removed. This was a lower molar. And I also had a cyst around an upper tooth, and that had to be removed. So Dr. Katranji put 2 implants in, one in the front, upper front area, one around that molar, and I have never had a problem with those implants. He does beautiful, beautiful work. I don't even know that they're in my mouth. They have never been a concern. So mostly implants work. They can fail, but a lot of it depends on, somebody who knows what they're doing and knows what has to be done and knows about your background and history. But I have two of Dr. Catrangi's implants in my mouth, and I've had them for many years, and I'm very proud of them and him.
And I thank you. Well, I think that's an important thing that he said is that implants are the most successful medical dental procedure on record. So we know that they're going to succeed, but they have to be placed in a certain environment. So the success rates are approaching 98, 99%. However, there are studies that show that maybe in somebody who's just learning or is just beginning to place implants, the success rates are a little bit lower. And a lot of that comes down to how you treatment plan somebody, making sure that these factors are not there when you place the implants. So that's the best answer we can give for that.
It's all very important. I mean, people really need to know that it's not just a one size fits all, that you need to get to the right person first time out the door. And like you said, it's like planting a plant. It's got to be planted in the right environment.
Absolutely.
And
Absolutely.
and also, talking about the screening and the diagnosis, I'm still overwhelmed by the diagnostic work you do in identifying and letting people see the pathogens that are in their mouth. And I think that was the big shocker for Olivia and myself, is to actually see in a 21-year-old how many pathogens are there that are going to obviously cause,
Yeah.
periodontal
Let me
disease.
interrupt. The reason that young people don't seek attention
I'm
is
going to ask you to hold that thought, Dr.
Sure.
Nemeth, and we'll come back. In the meantime, we're going to take a quick break. You are listening to the Dr. Nemeth and Dr. Catrangi radio show, and we are talking about the importance of diagnosing and treating gum disease and how it can prevent some of the major diseases of our time. If you have a question, you can call the doctors and speak to them directly at 800-859-0957. Again, that number is 800-859-0957. Don't miss this opportunity to talk to the doctors directly. You're listening to the Nemeth and Catrangi radio show on 760 WJR.
We had a couple of other questions. Now, I know we're not on the air now, although this is being recorded. So I want to address at least one of them, which is, it's an interesting question. It says, and this is from Benjamin, is it better to spit or rinse when you brush your teeth? Well, I would spit and I would rinse. I would do both. I mean, I would definitely rinse. It's not a matter of either or. You rinse and you spit. Another question from Tina is, with significant bone loss, will the all-on-4 work without bone graftings? How many hours does it take? Well, Dr. Catrangi, I think, what's your thought
So
on that?
most of our cases are done without bone. So a lot of these all-on-X cases, the cases where we're removing teeth or immediately placing a bridge, we're not doing any bone grafting, and that's kind of the goal for that procedure. Are there times where we bone graft? Absolutely. So for the most part, those things only take us about 2 to 3 hours per arch. So for an upper set of teeth, usually takes us about, let's say, 3 hours, and then on the lower, the same. It's about 2.5 to 3 hours. So it usually doesn't take too long. It's a one-day procedure, and nowadays with the technology that we're using in-house, we're able to do these things very predictably and very quickly.
There's a second part to this question from Tina, which I also will pass on to Dr. Catrangi, and that is, are there any health issues or conditions that would stop you from doing all-on-4?
So yeah, so anybody who's an uncontrolled diabetic, I'm not going to do it. As somebody, as you mentioned earlier, somebody who's on certain medications to treat osteoporosis, they're called bisphosphonates. They can cause issues for some patients. Heavy smokers, we will also avoid doing these types of procedures on. Anybody with an autoimmune or healing condition, those are the ones that we're avoiding. Almost any other condition, as long as we have a medical consultation and medical clearance, we just like to get everybody involved and notified about what we're doing.
Yeah, it's very important. I mean, I think that people need to realize that there's a lot more goes into it than just, oh, I'm getting a tooth pulled out. I need another tooth pulled in. But that other caller that was on the line, I wanted to ask you, what is this cadaver bone? What is that?
Yeah, so there's a lot of different ways to build up the bone. If I'm going to place an implant's like a screw, right? But it needs
Have something to screw
it
into.
needs a foundation, right?
Right.
So the foundation happens to be bone, and in some cases, after periodontal disease, we don't have any bone, and we need to create that foundation, and we do that through grafting. We use cadaver bone along with, the patient's own bone if necessary, and it works like a scaffold. It works like a scaffold, something that we can build off of, and then place an implant later.
Yeah, I mean, it's interesting. There's a lot more goes into it than just easily just planting a tooth in there. You've got to have something to hold the tooth into the bone.
Absolutely.
We did have
Anyway.
a caller come in. If you want to start with that, maybe.
Well, I
next
was going to
segment.
ask Dr. Nemeth to finish what he
Oh,
was
right,
talking
finish.
about.
That's right.
Right.
So after that, we'll go to the caller.
Yeah.
Okay.
Segment 4.
So I started to say, well, why do young people frequently neglect their
Right.
mouth? The reason is there's no pain.
Welcome back to the special edition of the Dr. Nemeth and Dr. Katranji radio show. I'm your host, Anne-Marie Cronin, and we're here tonight talking with Doctors Nemeth and Katranji, both board-certified periodontists in Southfield, Michigan. The doctors are with us tonight discussing the latest treatments in periodontic care and the relationship between gum disease and many systemic diseases, from cardiac disease to the prevention of Alzheimer's. If you have a question for the doctors on the topics we're discussing tonight, please call us at 800-859-0957. Dr. Nemeth, I'm coming back to you just before the break. We were talking about this screening that you do for the pathogens in the oral cavity, and I'm going to let you take the floor.
Earlier, you had mentioned young people,
Right.
think they're not in danger and are not concerned. Well, the reason is, first of all, I remember when I was young, about 2 weeks ago,
Yeah.
and I thought I was going to live forever. I never thought, you sort of feel there's a part of you that feels invulnerable, and you're strong and you feel good. You don't have any pain. That's the problem, because gum disease doesn't cause pain. So
Right.
young people, they don't have pain. And as far as they're concerned, everything is fine because nothing is hurting. Their dentist hasn't said anything to them. Sometimes they do, but very often they don't. And so they, without discomfort or pain, generally they think nothing is wrong. And this is the reason most people who lose their teeth lose it because of periodontal or gum disease. It doesn't cause pain, which is unfortunate, because if it caused pain, people would seek attention much sooner than they otherwise do.
Sure, that's what drives you to going to the dentist in the first place, is usually because you have a toothache.
Right.
Yeah. I want to introduce my assistant, Sue. Sue, why don't you come over here? This is Sue Tremonti, and she is my right hand when it comes to taking care of patients. Sue's been with our office for I don't know how many years, forever. And she knows as much about what I do as what I do. She could probably take over my job and do it at least as well. Anyway, she's invaluable. But I asked Sue to come today because she has thoughts, comments, and she may have some comments on some of the questions that we have or some of the things we talk about. And she's so knowledgeable about so much and so experienced that I just thought it would be great to have her here also.
Terrific. Do you want to take the caller first, or do you want to have Sue?
Let's take a caller. Sue,
Okay.
hang out.
Okay, yeah, so let's go to Carol in Tecumseh. Carol, what's your question?
My question is that I went in for a cleaning and all the x-rays, and I was told I have an abscess in one of my molars, which I believe is the one that has a crown on it. And so it was set up for me to have a root canal, and due to unexpected circumstances, I had to have it canceled. Anyway, I have listened to the doctor's programs before, and I know that it can be dangerous when you have an abscess. And I'm just concerned about having the root canal because one of the times I listened to the show, a woman called in and she had had root canals, and they said that she needed another one, and I believe the doctor said that there still was bacteria, that she really needed the tooth removed. And so that is what I am thinking, is maybe it would be better that I would have that molar removed and not have the root canal, and just make sure that the abscess is gone. So that is my question.
What do you think, Dr. Katranji?
So, I mean, as far as root canals are concerned, I personally have a root canal in my mouth, so I still feel like a root canal is a viable way of saving teeth, and that's always our number one goal. Is if we can save a tooth, it's more important for us to save the natural tooth structure. But then there are some times where the tooth can't be saved, and maybe in the previous situation, they've already had one root canal and there's another issue. When you're doing multiple root canals or you have to do surgery to do the root canal, at that point we may start balancing that against an implant and saying, okay, the implant is worth doing. But that's just one point of view.
Sometimes root canals fail. Quite frankly, they're not always successful. I've had root canals that have failed. Sometimes those root canals can be redone and be successful, but sometimes they can't. And in those cases, those teeth frequently need to be replaced with implants, removed and replaced with implants. There is a question here that I'm going to let Sue address. Sue, why don't you come back into the camera here like you were before, because she just brought this to me. And I'll let Sue read the question.
Is gum disease contagious? Actually, yes, it can be. It can actually pass the bacteria from one person to the next.
Absolutely, yeah, because gum disease is a bacterial infection. And so those bacteria can be transmitted to your partner or someone else. So it is contagious. It doesn't mean that you will get gum disease, because everybody has their own resistance and susceptibility. In addition, a lot of it has to do with how well you take care of your mouth. So if you're exposed to someone who does have severe gum disease, if you're taking care of your mouth properly, you are not going to get that gum disease, because the bacteria need to get a start. And if you know how to take care of your mouth properly, they're not going to get that start. You're not going to give them that opportunity. By the way, I want to mention one other thing about implants, and that is Dr. Katranji is going to be doing a kind of a unique kind of implant called a zygoma implant. There are individuals, not too many, who simply don't have enough bone for implants. So I'm going to let him talk about this a little bit.
Yeah, so unfortunately, we've been talking about these cases that come in and we replace all their teeth with implants. And there are times where there's just no bone, either because the periodontal disease was so extensive, sometimes it's genetic factors, and sometimes, to be quite honest, there's been a failed attempt at implants and there's no more bone for us to use, or even, grafting becomes something that might take a year and a half. And so zygomatic implants, or the zygoma implant, is a longer implant that anchors into a place a little bit higher than where the jaw is. So it kind of goes above where the jaw is and grabs onto bone, and allows us to anchor those implants and use them for the teeth. It's sort of like a last resort, and we're seeing more and more of these cases where they're necessary. And so for some patients, this is the the solution for them. This is going to give them the opportunity to have teeth the same day again with these implants.
It must be really disappointing for people who, lose their teeth, especially front teeth. I can't even imagine. And I know that was what Olivia was worried about, because they were her bottom 4 front teeth. And she was beside herself thinking, is it possible with this that I already have this bone disease from these pathogens that I didn't know were possible to exist? And she was so young, and she thought, am I actually at risk of losing my teeth? And it's really important that for anybody, I think, especially front teeth, you want to make sure when you get something, another tooth put in, an implant, that it's going to stay, be anchored, and not be a story where it's going to, pop out or fall out. So I think it's fantastic that you're taking this, precautionary move, and certainly, studying farther about what you can do to make sure you get it right the first time.
Yeah, but let's talk about that. So somebody goes in and they find out they have gum disease, they're losing their teeth. The first thing they think about is replacing those teeth. But
Right.
really, the first thing they should be thinking about is treating the gum disease,
Yes.
making sure that the gum disease doesn't impact anything else. And that'll also allow the implants later to become successful.
All right, it's all interesting. We're going to have to take a quick break. However, in the meantime, you are listening to the Dr. Nemeth and Dr. Katranji radio show. We're talking about how the treatment of gum disease can prevent many catastrophic diseases. If you have a question, you can talk to the doctors by calling 800-859-0957. Again, that number is 800-859-0957. Don't miss this opportunity to talk to the doctors directly. You're listening to the Dr. Nemeth and Katranji show on 760 WJR. Okay, we are back on Facebook.
Okay, so we're not.
And we had a call come in that right before the break, so we'll take that in the next segment too.
Okay.
Okay. What do we have here?
Do you, Amar, do you need to
This is
talk more
Beth,
about
by the way.
glaucoma?
You want to
We
take a
need to
picture
talk
of
more about
Beth?
it. You're good.
We're good.
Okay.
We have questions over there, Dr. Nemeth. Are you?
There is one
I
thing
have some
Okay,
questions
go
here, but I
ahead.
think that these questions might well be serve us well when we're back on the air. In
Okay.
the meantime, I just want to ask Sue, are there any subjects or things that you think might be interesting to talk about for our YouTube viewers?
How about sedation dentistry? That we provide sedation for our patients that are anxious
Yeah,
and or nervous?
yeah, and
No.
yeah. It's changed my life, and I think it's changed the life of our patients, because I remember before I was doing much in the way of sedation dentistry, sometimes patients would actually pass out, or they would faint because they were so anxious and tense that they actually passed out or they got dizzy. Well, when we use sedation, the patients are relaxed. Very often they just fall asleep, and it's so comfortable for them. And if they're comfortable, Dr. Katranji and I are comfortable, because if the patient is tense, believe me, it's transmitted right to our own brains and bodies, and it makes it a little more difficult to work with a stressed, really uptight, anxious patient. And so sedation,
It makes for a great experience.
a great
have
experience,
every-
and it makes our work much easier on the right kind of patient.
And I also know lots of people, Olivia included, my own daughter included, that are not petrified but fed up with being jabbed with needles. And you've got that little, whatever it is, that little X-ray thing that you can find where the vein is.
The venoscope.
Because
Yeah,
a lot, I hear about this all the time. People go to get to the phlebotomist to get their blood drawn. They're unsuccessful. And then there are people who are really afraid of it. They're actually afraid because they're going to be poked 15 times. And I mean, you must come across this. And I think it's great that you've got that technology. Everyone should have it.
Yeah. Well, yeah, we use for difficult patients who have,
Difficult
very
veins.
tiny veins, or
Right.
difficult veins. We have something called a vein finder, which actually uses a type of infrared. I think it's short infrared. Quite frankly, I don't remember the technical term, but it actually sees through the tissue. It can see through the skin to where the veins are, and then we know exactly, even though they don't show, we can see the veins with this vein finder that actually penetrates the skin, and we don't have to keep poking around to find a vein on difficult patients. So it saves a lot of problems there.
Okay, we'll come back and take the call.
Mhm.
Welcome back to the last segment of this special live edition of the Dr. Nemeth and Dr. Katranji radio show. I'm your host, Anne-Marie Cronin, and we're here tonight talking to the doctors, both board-certified periodontists in Southfield, Michigan. They're with us discussing the latest treatments in periodontic care and tooth replacement. This is our final segment, so if you have a question for the doctors on the topics we're discussing tonight, please call us at 800-859-0957. Again, that's 800-859-0957. And I know, Dr. Nemeth, you're holding a lot of papers there from people that have come in through Facebook and YouTube, but Siobhan is a caller.
Yeah, we have Dawn in Macomb Township. Dawn, what's your question?
Hi, I've had good oral hygiene and good dental checkups for years, and then 7 years ago, I was diagnosed with chronic Lyme disease, so a lot of health issues have spiraled. My last cleaning, she said she was surprised that my teeth had staining on them, but she was able to get it off. Since then, I've had inflammation in my gums on the rear left, like massive inflammation, and any herbals and stuff that I take kind of fits in there, so I have to be very diligent, but it's painful. And I noticed the top teeth, there's a pit in one of the top teeth on the inside, and then it's gray on the back of it. So I went to the dentist, and they did an x-ray, but they did not do an x-ray of the root. And I thought it was possibly dying because of the gray. So I don't know if there's something going on periodontal or what, but you know, I just, I'm not used to having anything with my teeth, so I'm confused. And I think people know that I have such good hygiene that they just, you know, they're kind of disregarding it and said, you know, since we can get the staining off, it'll go away. But I think there's something more because I'm having to do extreme things and it keeps inflaming and having pain.
Well, you mentioned Lyme disease, and it seems like you're kind of thinking maybe the Lyme disease has made you more susceptible to the kind of problems you're talking about. Is that correct? Hello, hello.
No, you know, they're looking into a lot of different things that are happening. So
Well, if you had Lyme disease can affect you in many ways, many of which we're not sure of, and each individual may be affected differently. So if your health is affected, by Lyme disease or by COVID or by a number of other things, it can affect your susceptibility to periodontal disease as well as other diseases. So is it possible? I've seen very bizarre situations, and it's possible that the Lyme disease has had some effect on your resistance or your susceptibility to pathogens or periodontitis, and maybe a factor, but you really need to see someone, you need to see a dentist or a periodontist who can really diagnose it and give you some insight that maybe you don't have or can't get from other sources as far as I'm concerned.
and it has a pit in it, does that, I mean, what does that usually point to? The inflammation is on the teeth under it, but I'm just not sure about the pit and the gray on the tooth above them.
Well, you have a pit in the tooth.
Yeah, I don't know how it's like on the inside. It's not on the grinding part. So, you know, I asked the dentist how it could even get there, and he said he didn't really know, but, you know, I don't even eat. I've had a lot of GI issues, a ton of GI pancreas issues as well, and so I don't eat like hard foods. I can't digest very well, you know.
Well, do you have GERD?
No, I don't have acid reflux, no.
Okay. Well, I'm really not sure. A pit is not usually related to periodontal disease, and I've never heard of it being related to Lyme disease, and it's difficult to know what might have caused that. What do you think, Amar?
The only thing that you know, I'm thinking is there's something we call abfraction, where when you put a lot of pressure on a tooth, that pressure can be transmitted to a part of your tooth that's the weakest, and you get these little pits and fissures that may not be, described any other way. So it's hard to say without looking at you. Honestly, it sounds like it could be one of a few different things, but it very well could be from your bite. It very well could be from the type of trauma you're putting on the tooth.
I have two.
That's also that has gray, like it's turned gray right behind that pitting. So I thought maybe the tooth was dying.
I'm going to answer this question. It's if a tooth turns gray, typically it means that the nerve is damaged or dead and may need a root canal.
Okay, Don, we're going to have to move on because we're running out of
Yeah.
time, and we do have another caller, Siobhan.
Yeah, we have Alan on the line in New York. Alan, what's your question?
Yes, thank you. So I'm concerned about gum recession and bone loss, right? I seen the dentist about 2 months ago, and they did measurements and told me that I was at 3 millimeters, 4 millimeters, and 5 millimeters. And I asked them, should I consider, doing the Lynette procedure to prevent, any deeper pockets and any further bone loss. So, that's my question there. I really don't want to gain any bone loss or have any more recessions.
Well, let me
was wondering-
let me interrupt because we don't have a heck of a lot of time here. If you have gum recession, the treatment for gum recession is different than the treatment for general periodontal disease. Periodontal disease, typically we can treat with a laser to slow or stop bone loss. If you have gum recession, and that gum recession is, as they measure, is getting greater and greater and greater, then you need something called the pinhole surgical technique to build up that gum and help cover the root surfaces. So you really need to be seen by your general dentist who can direct you, either take care of it or direct you to possibly a periodontist who can give you more answers. So there's two different situations here. One is gum recession, treated typically by the pinhole method. The other is bone loss between the teeth, or typical periodontal disease, which is often treated with a laser. Now, I'm going to interrupt here because I have two questions. One for me, which is easy, and the other one for Dr. Catrangi. I always give him the hard ones. So this is from Helen. How do you stop rapid bone loss? Well, you stop rapid bone loss by stopping the infection that's causing the rapid bone loss. And that's what we do in our office. And generally, rapid bone loss can be stopped if you stop the source or the cause, which is typically an infection from parasites and or bacteria. There is a genetic tendency which may make you more susceptible to rather rapid bone loss, but that doesn't mean you have to lose your teeth because of it. Now, also Tina, who had some questions before, said...
We have 30 seconds.
Okay. How long after you quit smoking can you have all on for?
So honestly, within the first few weeks, you're going to see a lot of improvements in the gum health. So I've done it within 2 weeks. I've done it within 6 weeks of smoking cessation. So pretty rapidly, the body just wants to heal, and when it does, we're ready to treat it.
All right, that's all good news for the listeners. Then there's hope out there. But unfortunately, we are out of time, and that wraps it up for the Dr. Nemeth and Dr. Catrangi radio show on 760 WJR, sponsored by the North American Society of Periodontists. I'm your host, Anne-Marie Cronin, and again, I want to thank both Dr. Nemeth and Catrangi for talking to us this evening about taking charge of our health, being proactive, and avoiding the devastating results of undiagnosed periodontic disease. Thanks also to my co-host, Siobhan Cronin. To take a closer look at the practice, please go to YouTube and search drnemeth.com. You'll find a wealth of information, videos on the many treatment modalities now available to treat gum disease. To learn more about Dr. Nemeth and Dr. Catrangi's periodontal practice, you can reach them directly at 248-357-3100. That's 248-357-3100, or by visiting them on the web at drnemeth.com. Again, that's drnemeth.com. We hope that you've enjoyed this special show and that you've become more informed about periodontal disease and its impact on the major diseases of our time. And thank you for listening.